Hi, this is Dr. Ian Pinto. I'm a cancer and a blood specialist. I've trained in the US for the last 15 years, trained in practice at centers such as Memorial Sloan Kettering Cancer Center, NYU, State University of New York, and I moved back 4 years ago, currently working at hospitals like Brca, Jaslok, Cefi in Mumbai. And today we're going to talk about cancer. What exactly is it? Can it be prevented and how can it be treated? I'm working with the Indian Cancer Society on getting this message out to you. So let's first start with what is cancer? That's the number one thing, right? If you know what is cancer, you'll fear it less. Cancer is a change in a cell. It mutates and it starts producing much faster than the surrounding tissue. So you get a lump or a growth or a bump, and that's normally how cancer presents to most people, a lump or a bump. Now, this is a world map of the number of cases of cancer across the world. As you can see, the highest incidences are normally in the US, Australia, developed worlds. And actually, if you see, India is all the way here, very low in the incidence of cancer. So then why are we here talking about cancer, right? This is a paper published just last year. And darker the colors, more the cancer cases. Lighter the colors, less the cancer cases. So this is the Indian map in 1990, and you can see fairly light, lower the number of cancer cases, and look at the drastic change to 2016. Lot of cancer cases. So clearly it's increased by a large proportion, and that's why everyone in the audience here has probably had either cancer themselves or known someone with cancer, a relative with cancer, someone in the office or building with cancer. So this wasn't there 10 to 15 years ago. This has increased drastically, so we need to figure out how to prevent it. Now, the Indian scenario is a little bit different from the rest of the world. 80% of patients who come in India come at the last stage when recovery is really, really difficult. We've often heard of excuses, I thought I'll wait till my daughter gets married or my son's 10th standard exam gets over, then I'll see a doctor. But then it gets a little too late. 70% of patients diagnosed with cancer here die in the first year. So clearly we're coming in the last stages. Another fact for India is most of the deaths, 71%, are seen in a younger population, so 30 to 70 years, in comparison to the Western world, where we are seeing that population die above 70. So younger patients dying here, larger volume, completely different than the Western world. What causes cancer? One of the biggest problems I've seen with all my patients is no one wants to say they're diagnosed with cancer. And the biggest reason for that is if I tell someone I have cancer, maybe my daughter won't get married, maybe my son will not get married, they say cancer's in the family. But if you can see genetic causes of cancer, that's just 4% of cancer, okay? The largest percent of cancer is tobacco. Almost 40% of cancer is caused with tobacco and tobacco-related products like gutka, pan masala. So you can clearly see that causes the largest chunk of cancer, and this is a preventable cause of cancer, something that we can prevent very easily. Obesity causes and lifestyle factors, 15%. Easy to order your food, use Swiggy, use Scootsie online, right? The food is at your doorstep. You don't even have to go to a restaurant to get stuff. You've got Domino's, Burger King, all these burgers and pizza chains. Easy access to really bad calories, right? And are you walking these days? Probably not. Why? Because you're Ubering it or Olaing it, right? So you're always using cabs, and of course we have no roads to walk on. 10% of cancer is related to infectious diseases like human papilloma virus. I'm going to talk about that a little bit later. Hepatitis B and C. And those are something that we can work on preventing. Diet and poor preservation of food, that means we're not storing our food adequately, that actually has gone down because we have better refrigeration now. 25% of cancer, we still don't know what causes it. We're working on researching, but the main point from this slide, 40% tobacco related. Today, the talk is mostly focused on breast cancer. It's the number one cause of cancer in Indian women in all cities, and also the number one cause of cancer deaths in Indian women. So breast cancer, as you can see, is increasing and it's causing a problem in most of our cities. Now, when we have a cancer, I told you cancer is a change that cells are producing really fast. We try to see where the cancer has started. For example, if it's a breast cancer, it starts in the breast, and then we look for, has it gone to any distant organ, maybe the lung, the liver, or the bones. If it has gone to a distant organ, it's likely a later stage cancer. Stages go from 1 to 4, 4 being the worst, which is a spread cancer. Now, we look at on the right side here, this is the US data for cancer diagnosis. Most cancers being diagnosed in stage 1, that's early stage cancer, okay? Well, here are the top 4 centers for cancer registries in India. Most of the cancers are diagnosed in stage 2 and 3. So we are seeing a larger proportion of our cases diagnosed late. So the question is, all right, you know, the US is diagnosing it earlier. Does it make any difference to have a cancer earlier or late? And when we look at data for survival, the 5-year survival for an early cancer is almost 100%. And that drops down to almost 25%, you know, if it's a late stage cancer. So it's a huge difference from being diagnosed early versus being diagnosed late. How do we pick cancer early? The only known screening method for breast cancer prevention is actually a mammogram. The goal of screening is to accurately identify asymptomatic disease. That means women do not have any disease and we're trying to find the cancer in them without them having any symptoms of the disease. So we can find it at an early stage and hence improve survival, okay? When anyone hears the word mammogram, some women often say it's painful or hurtful, but most women, you know, who have gone and experienced it at a good center normally do not have these, you know, symptoms from it. So it's a very well tolerated, easy test. A lot of misconception around the test. Another fear factor is radiation. There's really minimal radiation, and the survival. You're improving your cancer-related survival by around 20% by this test. So minimal radiation, a lot of positives. We have the older methods. That's the most common method is something called a film mammography, where they do just an X-ray of the breast. We also have digital acquisition of those pictures called a digital mammogram. And now we can actually reconstruct it on a 3D reconstruction to have a better understanding of smaller, you know, lesions out there. Now, when should we get a mammogram? When should we start screening women for breast cancer? Here are guidelines from across most of the developed countries. On an average, at the age 40 to 45, for women, every 2 to 3 years, you know, all the way up to 74 years of age. I repeat, 40 to 45 years of age, every 2 to 3 years, all the way to 74 years of age. Every woman has around a 15% chance of having breast cancer. There's a 15% breast cancer risk. A small percentage of women, around 5%, 4 to 5%, have an increased risk for breast cancer by having a genetic mutation called BRCA1 or 2. It's called a Brca mutation or a BRCA mutation. Now, when I say that, it sounds funny, but everybody's heard about Angelina Jolie, right? The actress, right? So Angelina Jolie had both her breasts removed, right? And the reason she removed her breast was because she had a BRCA mutation. So who has an increased risk of having these gene mutations? If the breast cancer is diagnosed really early, that's less than 50 years of age. If it is in sequential generations, grandmother, mother, and child, that increases your risk for breast cancer being genetically related. All patients with ovarian cancer should get a BRCA mutation testing done. Triple negative breast cancer less than 60 years of age. That means if you have no receptors positive, triple negative breast cancer should get a BRCA mutation. Now this BRCA mutation, if positive, has implications not just for women, but also for men, okay, in the family. So it's not just the women. Men can also get breast cancer, and men, if they get breast cancer, are more likely to have this BRCA mutation. So this is not just for women, also for men. Other risk factors to increase is oral contraceptive pills or hormonal therapies that have estrogen in it can increase your risk for breast cancer. And alcohol. Women are drinking a little bit more than they used to, especially in India, and also smoking more. And alcohol can increase your risk for breast cancer too. What decreases it then? So some of the good news, breastfeeding. A lot of people have been decreasing the amount of how many months they actually breastfeed their kids, and some just don't breastfeed. But breastfeeding is actually protective against breast cancer, and we must encourage it. Having children actually decreases your risk for breast cancer, and having a healthy diet and a fit and ideal weight actually decreases your risk for breast cancer. So we're going to move on to something called as cervical cancer. Now, cervical cancer was the #1 cause of cancer in India and the US. Currently, it's the #7 cause of cancer in the US, and it's #3 or 4 in India. And the only reason is something called as a pap smear. It's a very simple screening test to look for cervical cancer in women. This is done normally with your gynecologist or a general practitioner who's actually trained in doing a pap smear. And who gets a pap smear? Anyone above the age of 21 all the way to 65. Okay, so 21 to 65, and every 3 years is when we do a pap smear. Who does a pap smear? Either your gynecologist or your local general practitioner if he is well versed with the procedure of doing a pap smear. So for all the women in the room, 21 to 65, every 3 years, a pap smear. Cervical cancer is caused by this virus called Hpv virus, or human papilloma virus, and we have a vaccine now to actually prevent HPV. These vaccines are normally given at age 11 to 12, both for girls and boys. Okay, so it's not just girls, it's also boys. It prevents against HPV infections, vaginal vulvar cancer, against genital warts, and anal cancer also in boys. So Hpv vaccinations at age 11 to 12. We have different types of vaccines, one with 4 and 9 strain vaccine and one with just 2 strains. All are available here and should be administered. Now, moving on to colon cancer. So the thing with colon cancer is it starts from a small benign pea-like polyp or a benign lesion, and it takes a long time, 10 whole years to get to cancer. So we have 10 years to catch colon cancer really early, and a simple way to do that is a colonoscopy. And colonoscopy looks at your entire colon, that's the intestines inside your belly. It's a very simple and easy test. Who should get it? Anyone above the age of 50. Now if I ask the audience, who in the audience has actually got a colonoscopy, I would probably hardly see any hands going up, okay? And the only 1% I would see of hands going up would actually be because they had some problems. Anybody at the age of 50 needs a colonoscopy every 10 years. Also, if you have a family relative who has a history of colon cancer or colonic polyps, if they have had the colonic polyps less than 60, you should get a colonoscopy also a little earlier than your family member actually had the cancer. So if your family member had the cancer at 40, you would probably get it at 37. I'm also a hematologist, and a lot of times I see something called iron deficiency anemia or low hemoglobin. Normally, if you're nutritionally deficient or you're not eating well, that's fine. You can get an iron deficiency anemia. But in India now, in most places, our nutrition is excellent. So we shouldn't be seeing iron deficiency anemias unless you're losing blood somewhere else. Okay? And the most common place where you lose blood is in the colon from a colon cancer. So if you have an iron deficiency anemia and you're not having heavy periods, or if you're menopausal and you're bleeding and you have an iron deficiency anemia, one must look for colon cancer with a colonoscopy. Okay? Very, very important to know that. To lung cancer. Can we screen for lung cancer? Patients who are above the age of 55 years of age, and if you've smoked 1 pack a day of cigarettes for 30 years, or 2 packs a day of cigarettes for 15 years, then you need something called a low-dose CT scan screening. We don't use X-rays because CT scans, low-dose CT scans have actually shown to be better in preventing lung cancer, and you get it yearly for 3 years to prevent lung cancer. Now, for all the men in the room, it's very, very easy to, for prostate cancer, all you do is get a blood test. It's unfair for the women, of course. Clearly, I said pap smears and mammograms. Guys just have to get a blood test, okay? And who and when? Any male above the age of 50. It's a shared decision model. You talk to your doctor about it. Above the age of 50, you should be getting something called a PSA blood test or a prostatic specific antigen blood test. And if it's negative, you repeat it every 2 to 3 years. Most of my patients ask me when they come in, "Doc, how could I figure this, whether this was cancer or not? What were the signs?" And even the relatives are really, really worried, and they always wonder, "Can we tell, Doc? When can we tell whether this is cancer or not?" So the first thing I tell them is anyone with blood, any part of the body, sputum, urine, stool, bruising and bleeding uncontrollably, must go and get it checked out from your doctor. Everybody's trying to lose weight, including myself. So if you're trying to lose weight and you're losing weight, that's okay. But if you're not trying to lose weight and you're losing a lot of weight, your appetite is low, you're eating and feeling full really easily, that has changed from before, you need to go and check it out and see your doctor. Okay, that's another warning sign. Breathing, shortness of breath. If you're short of breath, climbing 3 floors, that's okay. But now you're suddenly short of breath doing even 1 floor, which you used to do very easily. That's a new change, and you should get that evaluated. Also headaches. Now I know everybody has a very stressful life these days, right? So you're always going to get a headache once in a while. But if it's persistent, especially waking up early in the morning and you're getting headaches, I would get that checked out. Lumps or bumps in any area should also be evaluated by your doctors. A lot of times I've heard patients tell me, "Oh, well, I thought the lump would disappear," but it just kept getting bigger and bigger. So if you have a lump or bump, you must get it checked out. If you have a mole, and the mole has any new changes, either it changes color, the shape, or there's some new changes of hair growing from it, that needs to be evaluated by a doctor too. These are the trends for cancer. Cervix actually decreasing in incidence or the number of cases, and the rest of the cancers seem to be increasing in India. What are the lifestyle changes that we need to do, to prevent cancer? Number 1 on the list: tobacco, tobacco, tobacco. Tobacco in any form, chewing, smoking, vaping. Vaping is actually banned in many countries, including India, and that's because it's turning out to be sometimes even more harmful. We don't have enough of studies there, but I would avoid vaping. Gutka, one of the worst things that you can ever put into your system. We're seeing younger and younger patients coming with wildly metastatic cancers from having gutka at a young age, and these cancers are very tough to treat. Physical activity. Everybody is striving to be physically active, including myself. The goal is 30 minutes a day, 10,000 steps. Very tough to do, but you need to keep working on it, to get that. Maintain a healthy weight. It's easier said than done, but if you get to your 30 minutes and 10,000 steps a day, you should be getting closer to that. Eat a diet rich in fruits and vegetables. And a lot of people ask me about vegetables and fruits. Wash them really well, because a lot of people are concerned about chemical exposure, a lot of the pesticides being sprayed on your fruits. If I was eating an apple, I would really skin the apple to remove any chance of having pesticide exposure on it. So wash your apples and fruits really well. A diet rich in fruits and vegetables, whole grains, and low in saturated fats. All the fast foods are pretty much saturated fats. Okay, so if you're thinking pizza, burgers, pretty much saturated fats, so I would avoid them. Alcohol. A lot of people used to say after 40, a drink a day keeps the doctor away. But we have new data saying even a drink a day can increase your risk, for cancer. So I would keep it to the weekend and, a shorter amount of alcohol. I'm clearly, not the happy person here cutting drinking, smoking, and any food that you want to eat, right? Protect against sexually transmitted infections. And in India, no one protects against the sun. We have tons of sun, right? But we don't use sunscreen. And we should start using it because skin cancers are increasing and sunscreen prevents them. And that's the easiest thing to do. Wear a hat or protective clothing away from the sun and use sunscreen. When I say cancer, people are really, really scared. And I say chemotherapy, and the person across me in the chair is almost going to pass out, because there's a lot of misconception about chemotherapy, either from Hindi movies or English movies where they see people throwing up, or family members talking about experiences that they've had with chemotherapy in yesteryears. However, that has changed now. We have pre-medications to prevent the side effects, and rarely do people feel nauseous during their chemotherapy currently. But chemotherapy can affect normal cells. They do cause toxicity in normal cells. So now we have something called as targeted chemotherapy. And we look at targets. These are small targets or receptors in cancer cells, so that the chemotherapy goes directly and kills only cancer cells. Okay? What are the advantages? Less collateral damage, less destruction to normal cells, okay? Higher response rates. Some of these targeted therapies are just tablets, so you can just pop in a pill and treat your cancer. And we have something called as smart bombs, I call them, okay? With all the bombs flying around, it's scary to say smart bombs, but it's a targeted drug, and now we attach chemotherapy to that targeted drug. So it literally takes the chemotherapy and drops it straight only on cancer cells. And this is available to us, and we use it especially in breast cancer. So this is a PET scan. A PET scan is normally used to stage cancer. It tells us where the cancer has gone. It's a young lady, 40, 45. She came for a routine exam, found to have stage 4 lung cancer. That's the lung tumor. This is 5 months later. There's no tumor on the PET scan with only a pill. She takes a pill daily, and that's about it. So sometimes stage 4 lung cancers, if we're able to find mutations, we're able to treat it with just a pill, and so very easily tolerated. Everybody's heard of immunotherapy in the news. Immunotherapy this, immunotherapy that. So what is immunotherapy? If you had a cold or an infection, right, we often, our immune cells or our T cells go and eat up the bad bacteria or the viruses, and that's how we get better, right? That's how we recover from an infection. So why doesn't that happen with cancer cells? Cancer should also be destroyed by immune system. That's because if you have your T cell or your immune cell, and this is cancer, cancer binds to this receptor called PD-1 and CTLA-4. So now you have a choco-blocked immune system that cannot go and find cancer cells because it's locked to the tumor cell directly. So we have immunotherapies that go and unlock this immune system, open the blockade, and now your own immune system is stimulated to go and attack your cancer cells. Chemotherapy decreases your immune system. Immunotherapy boosts the immune system to go and attack cancer. It's one of the blockbuster drugs, the PD-L1 inhibitors. They've almost had 15 US FDA approvals in a year or a year and a half. And that's the maximum number of US FDA approvals in the history of the US FDA. So this is a blockbuster drug. All of these are available in India for use, and patients with cancer can avail of those drugs. In India, when you're 60, people start thinking you're old. I don't know why, but 60 is considered like you're old, you shouldn't get any treatment. But chemotherapy can be given to people all the way up to their 80s, and I've given it even in the 90s. In fact, I have patients in their 80s more healthier and fitter than I am. So I had an 82-year-old guy with multiple myeloma. He works every day, in fact, and when he first came to me, he walks like 45 minutes a day, and I started treating him for his myeloma. He's 85 now, 3 years down. Complete remission, comes once a month just to get his treatment, okay? So if your patient is fit, if the person is fit, I've given chemotherapy all the way till 90. So age is not a limit for chemotherapy. Senior citizens, elderly patients do really, really well with chemotherapy, okay? We have a blood test called circulating tumor cells that looks at cancer cells in the blood. Currently, we use this as a prognosticator to see how well a patient is doing on treatment. In the future, we might be able to even diagnose cancer just by looking at tumor cells in the blood. We also have a blood test that looks at circulating tumor DNA. When we give chemotherapy to patients on treatment, we know the DNA of the tumor is changing, and now we're actually seeing what changes occur in that DNA of the tumor, and then we change the therapy based on that. So it's no longer a one-size-fits-all. It's a more personalized strategy for your cancer, for your tumor mutation, so that we can target it only for your cancer. So there's a lot of changes happening in the treatment of cancer. I put this slide up on CAR T cells here because this was the #1 innovation by the Times magazine a year ago. And everybody's heard about leukemia, right? I mean, leukemia is one of the most aggressive cancers. If you fail initial treatment, your chances of survival are less than 6 months. So they took 30 patients with failed leukemia. That means they failed, some of them even failed transplant, bone marrow transplants, and they took just blood from them, okay? They just took their blood, collected their T cells in a lab, exposed them to the antigen in leukemia, and just reinfused their own blood. And 3 years later, more than 90% of them are all in complete remission. The advantage of this is it goes wherever blood goes, and it goes even into the blood-brain barrier, so it can treat tumor anywhere, even in the brains, okay? And now we have a third generation CAR, which is actually a CAR T cell that's replicating in your body. So it's an active drug that's replicating in your body. Currently, this is approved for leukemias and lymphomas, and there are trials going on for all solid tumors on this. So in the future, I might not even be talking about chemotherapy. It just might be CAR T cells. Now that's a cigarette. It's got toilet cleaner in it. Okay, toilet cleaner, rocket fuel, paint, arsenic. You don't want to put toilet cleaner on your lips, right? No, probably not. And look at this. This is a human body. Name one part from the top to the bottom with cancer. So you're talking about oral cancer, your gastric cancer, your bladder cancer, lung cancer. Name any cancer in the body. It's all related to do with smoking. So if you take one message out of this talk today, it's to quit smoking or chewing tobacco in any form. Now is better than the future, so stop smoking today. Quit smoking, number one on my summary slide here, in any form tobacco is really bad. Moderate your alcohol consumption, have a healthy diet with exercise. Appropriate screening, as I discussed, mammograms, pap smears, colonoscopies, and a PSA testing. If you have symptoms, go to your doctor. Don't wait till your son's exam or the 10th standard or the 12th standard exam is over, or your cousin's wedding or someone else's wedding. Go immediately to the doctor so you find things early and we're able to treat you early, okay? Get preventative health checkups. A lot of times people get these health checkups and they don't see if there are any abnormal values in their blood tests. If you see any abnormal value on your blood test, and trust me, there's going to be 140 reports out there from a preventative health checkup, you need to ask your doctor about what that means. If your doctor is not able to give you enough advice on it, you need to go to a specialist to actually get that checked. I've shown you cancer treatment is really well tolerated, especially in the elderly, and we have targeted therapies now, and it's a more personalized strategy rather than a one-size-fits-all. So we've got a lot of new things, including immunotherapy, availing to treat cancer. So it's no longer as bad as it was. Thank you for your time and attention. My name is Dr. Ian Pinto. That's my clinic in Bombay, in Kemp's Corner. My number is 7045-348-071. I have my email address on the screen. Again, thank you for your time and attention, and thank you to ICS for helping us with sending this message out.